endowment was after having DMC, and then we discovered that the actual pregnancy was not intrauterine, it was an extrauterine pregnancy. So it is important to do a DMC plus histology always. An intrauterine pregnancy and an extrauterine, and do it here. This is another ectopic pregnancy, another ectopic pregnancy. Look at the ovarian texture and adjacent ectopic pregnancy texture. Mark the chorionic villi giving a brighter appearance. This is an intrauterine pregnancy, and this is the extrauterine one. Yolk sac is here. An abdominal pregnancy, an empty uterus you can see, and you can see a fundy sac mass containing a fetus. It was a light extrauterine abdominal pregnancy. Normally the ectopic pregnancy, tubal one, does not go up to this size. This is a larger one. It was abdominal pregnancy. It was not in the tube. It was outside the tube and outside the uterus. Abdominal pregnancy. Another abdominal pregnancy where you can see there is no uterine outline there. This is a femur, this is the head. Another ectopic case where the normal looking uterus, but the pregnancy was outside. This was a case of here the uterus is normal, but the pregnancy is actually located within the cervix. It was a cervical ectopic pregnancy. Sometimes an aborting sac in that location may resemble an cervical ectopic pregnancy, but in those cases there will be no dorsal blood flow and there will be history of bleeding. Uterus and adnexal area are scanned for myoma, adnexal masses, Purdy sac for fluids, and liver is also scanned for METs in cases of choriocarcinoma. Here is an intrauterine gestational sac associated with an ovarian cyst. In this case, the ovary was enlarged and there was no blood flow here. It was edematous. It was a tossed ovary. Here is an ovarian cyst with a mural nodule here. The mural nodule in the ovary. Another ovarian cyst with nodules, mural nodules. Although the ovarian cyst, although the size may not be very large, but this is showing a high diastolic blood flow. Ovarian cyst with fleshy masses projecting into the cyst cavity. Ovaries are also scanned, and sometimes you see the large follicles in hyperstimulated cases. Whenever the hormones are used for hormones and clomiphene are given, so ovaries may become hyperstimulated and can have a lot of cysts. In this case, this is an intrauterine pregnancy and there is a cervical large fibroid. Here is a case in which this is an anteverted cervix and a retroflexed fundus where you see a gestational sac here and embryo, and this was an anterior wall fibroid here. Adnexal mass, and this is a dermoid. One can see intrauterine contraceptive devices in addition to a pregnancy which is going on normally. Here is a case with gestational sac, right embryo, and you can see a clot here which can be mistaken for molar pregnancy. Here is a gestational sac, placenta is here, and there is a large clot there. Its volume was 182 ml. Some slides of the molar pregnancy. Uterus, we expect to see an embryo there. Instead of an embryo, we see echogenic mass with multiple small cystic areas. This is the typical picture of the heavy form hole. This is uterine wall. with molar material of almost 417 ml in volume. Molar tissue in the uterus. This is uterine wall. Some more molar tissue slides, typical. And sometimes, in addition to the molar tissue, we can have an embryo dead or alive. And that embryo is always abnormal. Molar tissue and also the embryo. And we should also look at the ovaries, because some of the ovaries will contain 40% of the ovaries in molar pregnancies contain fecal luteal cells. Molar pregnancy slide. Molar tissue plus embryo. Here it is molar tissue here, but there was also hemorrhage and clots there. In this case, this was an alive embryo, and this embryo had the normal looking placenta, but adjacent area also contained a thickened placental molar type of tissue. So there was twins. One twin was molar and one was normal. Yes. This is normal placenta and embryo, and adjacent we can see the abnormal molar tissue with cystic changes. Cystic area, this is typical molar tissue, and this is what is described as snowstorm appearance. Nowadays, with better machines, we can see the cystic areas properly. Uterine arteriovenous malformations, recurrent more, invasive more, choriocarcinoma. Some of these slides resemble each other, and history of DNC, aggressive DNC will result in this. And if beta HCG is positive and rare, then we will be seeing these two things. And if there are METs also and signs of invasion, then this is the choriocarcinoma. Some of the slides, this is the AV malformation. Patient presented with once DNC, then twice DNC, and after that even then she kept on bleeding. On B mode, the aggressive vascularity is not appreciated, but on color Doppler you can see the same patient. This area looks almost normal, but actually this is there you see a lot of vessels, an empty uterus, large fecal uterus, and some invasive or recurrent molar tissue here. Molar tissue with cystic changes, that is the cervix. Aggressive vascularity there. In this case, there was dead embryo and the gestational sac has reached the os. A case of missed abortion, another missed abortion, an embryonic gestation, anencephaly, no head is visible, and absent calvarium, dead embryo. Embryo in one horn and the other horn is empty, and there was bleeding from this side. History of recurrent bleeding after DNC for abortion, and on Doppler you can see the aggressive molar tissue there. Small sac and large fetus. They are small fetus, but the placental tissue is large and there is thickened and there is a flow, Doppler blood flow. Are dead, embryo no cardiac activity, hydropic type of fetus. Pregnancy, intrauterine pregnancy with a fibroid, twin gestation, dichorionic, diamniotic. This is dichorionic, diamniotic, and this is monochorionic, monoamniotic. And separating membrane is very thin. Here it is large. One fetus larger, one smaller, and dead. Conjoined twins. Here you see the two fetuses cannot be separated. Here. Another case of conjoined twins. Monochorionic, one placenta, and diamniotic This is dichorionic diamniotic, 2 corpus lutea, 2 gestational sac, 2 dead embryos, twin pregnancy. One is in the upper floor and one is in the lower floor. There is cervix. Hydrospitalis, you see cystic erythematous tissue in the neck area. Nuchal translucency, measurement must be very accurate, and one should measure only this hypoechoic area and not the other amnion. Other amnion should not be included. Here you see a normal fetus with normal nuchal translucency. It should always be less than 3, and this is the amnion. This should not be included. In this case, the nuchal translucency is increased 7 mm. It's seen in trisomy 21, Down syndrome, and in many other chromosomal anomalies. Some more slides of RPOCs are here. These are vascularized RPOCs. A missed abortion, another case. Acrania. Large fetal tissue, less amount of sac volume, and oligoamnion. Small for dead fetus, small fetus, large sac. This was the right arm was gravid and the left was empty. Increased vascularity in the wall of the uterus in cases of molar degeneration. I'll end my presentation here. Thank you very much. Any questions?
For tea break, and you have to move to the other side of Karachi, President of Ultrasound Society of Pakistan. He is going to present a 2 hours short course on fetal echocardiography. So I feel honored to invite Dr. Musar.
Thank you very much, Dr. Ahmed, Dr. Tawseef Kamar, all my colleagues, and thank you for being here this morning. Without wasting any time, I guess we should start and have a good so that we can start this field echo. All right, this Bismillah in the name of Allah, the gracious, the most merciful. This presentation comes to you from our Institute of Ultrasound, the Learning Center, which is affiliated with Thomas Jefferson University Hospital, Philadelphia. And just a few announcements as this movie is going on. We are arranging an endovaginal course for a week in Karachi for lady doctors. We'll be talking about some procedures as well and hands-on for endovaginal. Those of you are interested. There's a conference in India, New Delhi, Asian Federation Conference in November 18th. Those of you are interested to join us. There's another conference in Australia, which is the 40th annual celebration of the Australian Society of Ultrasound, and that's in September 24th, 25th, 26th of September 2010. So those of you who are interested in that, please more than welcome. So this institute, which is affiliated with Thomas Jefferson